Let's chat with Denisha presents the series Don't Suffer in Silence Women's Reproductive Health with gynecologist Dr. Kelly. Come on and join the conversation where we speak about the different topics concerning women's reproductive health. Join us this and every Wednesday via YouTube Live, 7 p.m. Eastern Standard Time. Ask all the questions you want to be answered.
Your reproductive health is important.
Welcome back, guys, as we continue the discussion on endometriosis. In this video, we will be talking about the treatment options for endometriosis. If you have not yet watched part one, click on the link right above, watch part one, and then come on
All
over
right,
to
so
part
let's
two.
go to treatment. Like, I'm a woman, I'm feeling these pains, like I'm bleeding heavy. It's like I dread my periods. What can I do? What's my first step? And then what are my options?
All right, so treatment essentially usually entails treating the symptoms because, of course, it's not something that you can switch a button and the person is cured, right? Because,
Mm-hmm.
of course, this is a part of the individual, and so
Mm-hmm.
treatment usually start with, so if the patient having pain, depending on how bad it is, you can start the patient off with regular pain medication. So your non-steroidal anti-inflammatory drugs. You might be familiar with Advil and ibuprofen, and then you
Mm-hmm.
have, of course, you have stronger ones. Sometimes what they can do is to combine the these pain medications with other hormonal medication. Same thing that people would call we call it family planning or birth control,
Yeah.
right? So they
Mm-hmm.
combine those with the pain medication, and this for a good portion of patients would actually help with their pain and bleeding and some of the other symptoms that we mentioned. Um, for those persons who medication is not found to be helpful, then there's
Mm-hmm.
surgical treatment. So we spoke about laparoscopic surgery with the
Right.
that pinhole surgery with the camera.
Mm-hmm.
So a part of making the diagnosis, they can actually we call stripping, where we strip off the abnormal endometrial tissue that are found in those areas,
Mm-hmm.
which would help to relieve pain. And for some women, they actually would have cysts on the ovaries,
Oh,
which can be
yes.
painful.
Mm-hmm.
And these cysts are usually just filled with blood. So
Mm-hmm.
removing these cysts as well can bring some relief and, of course, help to the patient. And so that's surgery. I mean, barring this, for persons who have explored all of these options and have completed um, fertility, so they have no desire for having any kids,
Mm-hmm.
you can actually have surgery done to remove the womb,
The womb.
and depending on how old the patient is, ovaries as well. But again, this of course brings significant relief, but for some patients, they continue to have pain and would definitely need medication.
Okay, so this now is a question. After I've exhausted my options, I'm still at childbearing age.
Right.
Um, do I have to, well, do I have to live with endometriosis or will it come back after the treatment? What? Because just in the case like fibroids, you know that these
Right.
these things after many years has the
Can
possibility of
return.
coming back. Yes.
Right.
So in the case of endometriosis.
So you're right. So of course, even with doing the surgical procedure of stripping, it's going to be difficult to remove every single deposit
Ooh.
that is there, right? So
Mm-hmm.
there's a yes, the pain will be better, symptoms are improved, but there's a potential, a possibility that this can again escalate, and so
Oh my
follow
God.
up follow up is important.
Yeah.
Follow-up is important. So it's unusual at the extremes of age, so the very old or the very young, but
Mm-hmm.
it can occur.
Okay. Thank you so much. Thank you so much, Dr. Kelly. Guys, I know we have learned a lot today. If you have any questions, please send them to my email at denishajared42@gmail.com. We will see you again on the topic, Don't Suffer in Silence, Women's Reproductive Health. Thank you.
If you are serious about your reproductive health, contact Dr. Clayton Kelly at claytonrichardkelly@hotmail.com, 876-829-6041. Remember, your reproductive health is important.